Hi, my name is Molly Pierce.
Hi, my name is Zoe McIntosh.
And my name is Samantha Erny, and we are here to present our capstone project on coping mechanisms for stress and anxiety in undergraduate nursing students.
We decided to look into this topic as we found statistics that show 30.2% of nursing students report high levels of anxiety and 82.4% of nursing students report moderate levels of stress. Based on these alarmingly high numbers, we decided to create a project investigating coping mechanisms for stress and anxiety in nursing students. The purpose of this project is to identify coping mechanisms for stress and anxiety in nursing students and educate freshman nursing students on the coping mechanisms. To begin our project, we reviewed current evidence of the topics of stress and anxiety in nursing students and coping mechanisms for this topic. We found relevant search articles using the databases CINAHL, Google Scholar, and PubMed. We used the search keywords of nursing students, stress, anxiety, coping mechanisms, and relief. The search limits we used to specify our research was peer-reviewed, full text available, English language, articles within the past 7 years. While looking at current evidence, we noticed several recurring coping mechanisms that occurred across our research. We decided to group these coping mechanisms into 4 main topics to educate undergraduate nursing students on. Each topic has multiple research articles proving their effectiveness in reducing stress and anxiety levels in nursing students. The evidence-based topics we educated undergraduate nursing students on are music therapy, diet, exercise, and nutrition, mindfulness, meditation, and aromatherapy, and mentor and support systems.
Our education plan consisted of presenting to a class of 40 freshman nursing students during one of their regularly scheduled classes on Zoom. The presentation lasted roughly 30 minutes and consisted of a pre and a post test, a video about how stress and anxiety affects your health, definitions of stress and anxiety in nursing school, and positive and negative coping skills. The primary part of our education was providing details about the 4 main coping skills previously mentioned, as well as resources to help in stress and anxiety management. As for our evaluation, 10 questions were included on the pre-survey and 8 questions were included on the post-survey, 6 of which were the same on both the pre- and post-surveys. 37 responses were collected on the pre-survey and 30 were collected on the post-survey. Out of the 37 responses on the pre-survey, 94.6% of students stated their stress and anxiety levels had increased since starting nursing school. After the education presentation, 73% of students were able to identify at least one of the 4 main positive coping skills we discussed. Overall, the goal of educating these students on coping skills for stress and anxiety was achieved.
We would recommend that education on stress, anxiety, and coping skills be taught to undergraduate students. Additionally, universities should make resources to aid in coping skills more readily available. The limitations of this study included that the information was presented to a small population and there were not an equal number of pre-survey and post-surveys filled out. Researcher interpretations were subjective and could be limited by decreasing the number of extended response questions. This could be done by rewriting the questions to be select all that apply. Further research should be conducted by educating first years and then following up in their 4th year to see how coping mechanisms help throughout their nursing degree. We would also want to implement our education project to multiple grade levels. In conclusion, academic demands of nursing programs are growing, as are the stress and anxieties associated with increased workloads. By teaching nursing students coping mechanisms such as music therapy, mindfulness, exercise, and mentorships, as well as physical wellness, stress and anxiety levels will be significantly decreased. Our research showed that an increased knowledge of stress and anxiety management and retained methods on how to positively cope are significant in success in nursing school and professional careers.
And these are our resources. Thank you.